Hello, everybody. This is a quick overview of our pathology management platform that works with both SystmOne and EMIS. We have longer webinars on our webinar page. This is a quick overview just to run through the functionality. This is a super powerful platform that can look after over 200 different pathology tests. It's also capable of reading pathology test lab reports as well. The principle behind this tooling is to free clinical capacity as well as enforce protocols at practice level. Think of MyBotGP as a big filter at the front of the practice. All of your pathology tests will run through MyBotGP. You will set predefined protocols for each pathology test in terms of whether you want your normal test to be filed without being checked, or whether your normal pathology test will trigger a patient contextual check to determine whether you want to continue your clinical exploration with that patient, or if you're happy to file that test. So this is the scenario. Again, this is only going to be a 5 or 6 minute description, so please bear with me if I'm rushing through. The principle is the business case we're choosing here is for an 8,500 list, which may have around 5 partners. They will be receiving somewhere in the region of 62,500 pathology tests every year. That number's pretty accurate. So a list double the size will receive double, and 50% will receive 50% of that. All of those 62,500 pathology tests, or just under, will pass through the clinical team, which is a significant clinical continuous workload. Now, in reality, 80 to 85% of those pathology tests come back as normal from the lab. Now, normal from the lab obviously doesn't mean normal for the patient, because labs are only there to check the path test. They don't take patient context into consideration. So manually, what your team are doing is they're physically reviewing all of the path tests and sieving through thousands and thousands of path tests a year to find the ones that they need to focus on, which is essentially a waste of time. MyBotGP will look after this 80%. It will file all of the normals, and then within that 80%, approximately 20% of pathology tests that come back as normal require clinical contextual checks. So i.e. Lab has said it's normal, but I don't want to file that if the patient has this health condition, or I don't want to file that, I want to continue my exploratory work despite being sent back as normal if this test has gone up or down by a certain percentage. Or perhaps you don't agree with the lab ranges and you'd like to set your own protocols, your own ranges. MyBotGP is able to do that as well. You might want to check for percentage increases or decreases and so on. As I mentioned before, MyBotGP can also read the pathology test report itself and look for keywords and warnings. So I'll come back to the rules in a moment, but it provides additional safety, ensuring nothing slips through the net. But 62,500 pathology tests come through, approximately 80% are normal. That's almost 50,000 pathology tests passing through the clinicians, and additional included in that 20% of those, which is almost 10,000 tests a year, you are doing manual patient contextual checks. And then either filing or flagging. MyBotGP will do all of this for you in the background. It works 7 days a week, 365 days a year. Current cost time savings are somewhere in the region of £50,000 a year of practice clinical capacity cost allocation can be recouped, and an 8,500 list will get about 95 days of clinical time returned. Now, all path tests sit in 3 buckets. Normal, don't need to look at it. Normal needs a patient contextual check to decide whether it can be filed or you want to continue your exploratory work, or abnormal. As I touched on before, MyBotGP will cover all of those 3 scenarios, over 200 different pathology test types, which is pretty much all of your path tests will pass through MyBotGP. It will do the initial screening, and anything left in your inbox will be there because you want to see that test. Everything else will be filed. In addition to that, you can omit patients, and MyBotGP can send text messages as well to patients if you want it to, and we can cover off that in a more detailed webinar. So just to summarize our rules, MyBotGP can agree with the lab, or you can supersede the lab. Many of our clients supersede lab ranges for some of the subtests in full blood count, prostate. They want to set ages and ranges and check for conditions, EGFR, lipids, and many other tests to make sure that that they are accurate as based on their protocols. You can check for health conditions. You can compare tests against previous test results for percentage increases or decreases. You can supersede lab tests in terms of age or gender. MyBotGP can read path test reports, massively important because you'll get thousands of path tests a year that don't have ranges. MyBotGP will need to look for keywords, detected, not detected, positive, negative, in addition to warnings. So some of our clients have HbA1c, for example, comes in at 20 to 41, but the lab will put a warning of pre-diabetes. So the clients, some of them agree with the lab ranges, but say, however, flag it if it says pre-diabetes, send the patient a text or just leave it for clinical review. Obviously, you can omit patients and you can send text messages as well. Very simple configuration panel. This is your product. And we'll come back to here just as a quick summary. We're an NHS ICT partner. We are a private UK business, so it's unusual to have this, but we have access to NHS Cloud. So DTACs, DPIAs are very straightforward, all fully compliant. Medical device, and we also have a DCB 0129 certification and a DCB 0160 to share for those who would like to use it. And part of our pedigree is we were an Innovation Launchpad graduate program several years ago, which is an NHS funded Launchpad program for health in tech. So very, very quick summary, short bit on pricing there, just 5 to 7 minute summary. Please contact us if you would require further information.